Estás viendo Canal América, televisión dominicana para el mundo.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your fears.
Welcome to A Time for Truth show. I'm your host, Dr. Bernard Fialkoff, and it's a pleasure to have you back with us again for this segment. And many of you have been asking, how do I get to watch the previous segments? Because some of my friends have told me about the program, and I'd like to see them. And you can do that on YouTube, A Time for Truth show, and click subscribe. Tonight, we have a very special program because it deals with very important human beings, women, those mothers who brought us into the world, who give love, who basically are really the fabric of our world, who make our groups and families and communities actually thrive and go. And today, Fermin, if you put him up on the screen, the pictures, we want to introduce to you our special guest. There he is, Dr. James Gohar, a practicing obstetrician and gynecologist with over 20 years of experience in the medical women's health space. He received his medical degree from the historical Cairo University School of Medicine and completed his residency training at the Medical College of Georgia. As a leader in women's health, Dr. Gohar has dedicated his career to delivering personalized, ethical, and outstanding quality care at his Forest Hills, Astoria, and Manhattan offices. After taking ownership of the Women's Health Medical Center, Forest Hills Medical Services, in 2013, and establishing a specialty women's outpatient surgery practice in 2016, he launched Viva Eve in 2021. You saw some beautiful photos, and there you see another of Viva Eve. Viva Eve is a health destination offering integrating specialty care for women, ranging from OBGYN services to fertility to fibroid treatments. Through Viva Eve, his mission is to redefine women's health care, to empower patients as active participants in their own personal health care journey. Dr. Gohar is a member of the American College of Obstetrics and Gynecology, American Medical Association, Augusta Obstetrics and Gynecology Society, Georgia Obstetrics and Gynecological Society, and the American Association of Gynecologic Laparoscopy. Dr. Gohar is driven to expand Viva Eve services, which center on top-tier patient experience and state-of-the-art medical techniques. He serves as clinical instructor at Weill Cornell School of Medicine and is attending OBGYN at Mount Sinai West and New York Presbyterian Hospital. And Fermin, if you will, if you put him up on the screen live, I want to bid a warm welcome to Dr. Gohar.
Dr. Fialkoff, thank you so much for the warm welcome. Greatly appreciate it. Thank you so much for the kind words. Look, it's an honor to be here. I'm really happy to join you here today on the program.
It's our pleasure to have you, and I want to get right to it because I know there's so much you have to discuss. So how did you decide, first of all, on your medical career and subsequently OBGYN?
You know, it's funny, Dr. Fialkov, one often has a perception of reality that sometimes over time you begin to put the pieces together in a little bit of a different way. I was one of those kids who just always wanted to be in medicine, probably from a very young age. As far as I can remember, I always had in my mind this idea of wearing a white coat and helping my patients and helping people fix problems. And recently I was hanging out with my parents. So my parents are in their 70s, and they were pulling out like, old family photos, and they showed me a picture of me being like, about like 3 or 4 years old, wearing a stethoscope. It was my dad's stethoscope. My father was a physician, so was my mother. And I was examining my grandfather when he was on his bed. I think it was a few years before he passed away. And so who knows? I mean, I think, certainly I grew up in a medical family. I think that was part of it. My mother happened to be an OB/GYN as well. So I think it was something I was exposed to at a very young age. And something I've always was very passionate about. I think OB/GYN in particular, I think, is a unique specialty in the sense that it's mostly a happy one. We have a chance to help women and actually fix problems and help people, deliver babies and fix medical issues that may be bothering them. So I think, unlike some of the other specialties in medicine, which are mostly dealing with chronic conditions that don't actually get better or don't allow someone to build that continuity that you have in women's health, those things were less appealing to me. I love the idea of being able to build relationships, know our patients, know their families, their kids, their mothers, their aunts, their best friends, and all that continuity that goes along with it. So I think it's a beautiful field, one that I feel very lucky to be a part of.
Well, I think you made a fantastic choice. And I wanted to ask you, because for all the women viewers out there watching the show, what are some common mistakes that are made in terms of women's health care?
Sure. I mean, I think there are all sorts of things that we see. I think one of them, I think sometimes is when sometimes people have various symptoms that they ignore for periods of time. One of the things I think that happens with the human body is that when something happens slowly, gradually, we have a remarkable ability to adapt and adjust, and our body does as well. And so sometimes people will, begin having, heavier cycles, for example, and it'll begin to, instead of it being maybe 4 days, it becomes 5 days. Instead of it being maybe, 3 pads, it becomes 4 pads. And then gradually over a period of time, it really can start to affect their quality of life. And there are often various medical conditions that one can deal with and diagnose and manage if these things are brought to their physician's attention. And so I think quality of life is something that we all, deserve. And I think that often, as you had mentioned, I think women often are the fabric of their society, fabric of their families, of their groups, of their relationships around them. And I think sometimes, various patients of mine I've noticed over the years often put themselves last and often think of everyone else around them and don't think of their own health and their own quality of life. So I think that's one of the mistakes that happens. I think another I would say is, probably not planning ahead. So I think if someone is hoping to build a family, for example, I think preconception counseling is something that's underrated. Usually we recommend for women, who are thinking about having a child to, plan for it at least, say 3 to 6 months in advance. There are certain tests that we can do. There are certain plans that one can make. There's all sorts of steps one can take in order to optimize a pregnancy and improve one's chances, because there's all sorts of things that can happen. And it's always better to be a step ahead than a step behind. I think those probably be the top 2 on my list.
Well, thank you for sharing that, because, it's what you're doing is so important, because you're bringing future generations in, and the mother is the crucible, the oven, whatever. She's creating that child. So it's what you're saying makes total sense to me as a doctor. And it's important for them to know that. So the next question I had again for them is, what should women know regarding their pregnancies in order to ensure that they have the best possible pregnancy and that their child is born as healthy and as well as possible?
Sure. I mean, I think there's a few things one would suggest. I think, getting preconception counseling and meeting with their OB/GYN, I think in advance is a really great strategy. I think, one thing we often talk about, for example, on the fertility side, is how the world has changed. We all go to school a lot longer. We work a lot more. It used to be that if you look at like what the typical family looked like in the 1950s or 40s, it used to be one working parent. Now there's two working parents, and often many of us are having to collaborate and work in a very different way. And so what's happening is, I think historically, compared to where we've been as a society, is people are starting later. They're beginning to conceive in their mid to late 30s as opposed to in their 20s or even younger, if you look at history prior. And so I think there's some things that one might want to keep in mind. I think, in general, when we test for certain, genetic disorders, there's been tremendous advancements in OBGYN over the last 20, 30 years. So there's all sorts of non-invasive tests that one can do today that allows one to, reduce the risks of things that happen prior to pregnancy, before even when someone gets pregnant, and then even when someone becomes pregnant, within those first 2 trimesters, that allows one to really navigate that in a lot more of a purposeful way. I think something as simple as prenatal vitamins. Prenatal vitamins are actually one of the only interventions we can take. Mainly folic acid, by the way. That's the main ingredient in it that matters. I often say to my patients, you can spend $5 on prenatal vitamins, or $500, by the way. Please don't ever spend $500, because they're all the same. But if you're really getting into the specifics, the folic acid supplementation is one of the great discoveries we've had over the last few years, over the last 20, 30 years, in the sense that it's one of the few things one can do that directly reduces the chance for birth defects. And so it's such a simple thing. And unfortunately, the most important time to use that supplement is prior to even knowing that you're pregnant. It's before someone even misses their last menstrual period. And so usually what we recommend to our patients at Viva Eve is for anyone who's of the reproductive age, who's not using birth control, to always just take prenatal vitamins and just look for that one ingredient. All the other ingredients don't matter. I know that a lot of the different boxes and bottles come in various different colors at various different price points. And they often try to convince people to buy them for various reasons, but really it's just folic acid that matters. We look for 800 micrograms at least. There's 800 micrograms is the recommended dose. And just so you know, there's 1,000 micrograms in 1 milligram. So often that's something that can confuse some of our patients.
Very, very, very good. Thank you for sharing that with us. Now, I want to go to the other end of the spectrum, and for our older women. And is there any nutritional, or obviously there's medicine and hormonal and whatever things that you would do, but is there anything nutritionally or some other technique or treatment that a woman could do who's menopausal, who's experiencing these hot flashes, this burning, and I hear them complaining of?
Sure. Yeah. I mean, menopausal symptoms are quite common. Not everyone gets menopausal symptoms. What we consider to be menopause, by the way, just speaking in general terms, the average age of menopause is 51, plus or minus 7 years. So anything from 44 all the way through 58 can be the beginning of menopause, depending on the woman. And once it starts, it doesn't really always start just like that. Like often there's a process and there's a time around it. And so what we often will talk about is what we call the perimenopausal period, the time before and the time during and the time after. And to answer your question directly, Dr. Fialkov, I mean, there's a whole range of things one can do if someone has symptoms. Let's say about maybe anywhere from a third to a fourth of women will have significant symptoms. The majority of women actually do pretty well. These can be hot flashes. These can be mood changes, vaginal dryness, hair dryness, hair loss, skin dryness. These are all the various symptoms that some women will get and experience to different degrees. The best treatments always, unfortunately, are hormones. Hormonal treatments are considered to be first line in terms of the most effective. I say that unfortunately because there are some downsides for some women, but the pendulum has really swung back over the last few years. There used to be a time back in the 1980s where everyone was getting hormone replacement therapy, even women who were in their 80s or 90s. And then I think, back in the late 90s, early 2000s, there was a study that came out that really discouraged everyone from using hormone replacement therapy because the concern was about certain risks to the breast and to the heart. And I think now where we've all, I think, landed as a community is it's somewhere in the middle. We feel like within the first 5 years of menopause in particular, whenever that may be. So if someone's 51 and they get menopause then, from 51 to 56, we feel that's a very safe phase for someone to use hormone replacement. Beyond hormone replacement, we have certain supplements one can use. There are also some certain medications. We actually use antidepressants, if you can imagine, not because of depression, but because there's a center in the brain that's responsible for heat, and it's right next to the center that's connected to anxiety. So we'll often use what we call SSRIs, which are selective inhibitors that help with certain neurotransmitters in the brain. And there's also some other medications that we'll use as well, and supplements, everything from black cohosh to something called gabapentin, which is a medication that's used often for nerve pain, but we find it to be quite effective for hot flashes as well.
Okay, I understand. And so sometimes I see that, unfortunately, someone will develop fibroids. What is the treatment span, or what are the alternatives for fibroids?
Yeah, fibroids are a remarkably common problem. We find that as many as 30% of women by the age of 35 will suffer from fibroids, and as many as 70 to 80% by the age of 50. And so it's really quite remarkable how common it is. It's much more common in women of color, of all color, by the way, not just Black women, but also women from South America, from Central America, from Africa, the Middle East, Eastern Europe, Asia. But it's 3 times more common in Black women than other ethnicities. And ultimately, it is essentially a benign growth of the uterus. It's essentially smooth muscle tissue that goes haywire. The uterus is made of smooth muscle. And once this tissue goes haywire, unfortunately starts to cause symptoms for many women. Not all women, by the way, get symptoms. So it's only about 30% of women who have this condition actually need to get treated. And the way we decide on who gets treated really comes down to the significance of their symptoms. And the symptoms can range from a variety of around 5-6 symptoms. They can be heavy cycles, painful cycles, pressure symptoms or bloating, pain with sex, urinary symptoms. These are all the various types of symptoms that a woman may get. And some women are very unlucky; they get all 5 or 6. Some women only get 1. But once that occurs, now we start talking about quality of life. Then we really do want to treat. So there's really mainly 4 different treatment options in 2022 that are that's generally accepted across the medical community. One is medication, and usually those are in the form of injections, but there's some oral medications that have come out recently. And what those do, they really essentially put someone in artificial menopause. That's basically the way they work. So they're not very popular, unfortunately, and they often, are used short term for a period of time. They're not popular for the reasons that in terms of symptoms. But they do help shrink the fibroids and reduce the blood flow for a period of time. So they can be good stopgaps. The second option is one that really, unfortunately, is all that was really being offered for most women, most parts of the world, which is a hysterectomy, removing the uterus. It's really a drastic option that we like to leave as a last resort. Especially at Viva Eve, we like to pride ourselves in leaving that really as a last resort, only if necessary. Third option is what's called a myomectomy. And there's various ways that we do this. We do this through a variety of mechanisms, either robotically or laparoscopically, or sometimes we will open, if necessary, the belly in the form of like a C-section scar. That's where you cut out the fibroids one by one, and then you repair the defects. There's some pluses and minuses to those treatments, but they're very reasonable treatments. That's something I do myself as a GYN surgeon. And then we have uterine fibroembolization, which I think is a pretty remarkable option. It's also something that we're also quite known for at Viva Eve, because we have a team of intervention rheologists as part of our group. Intervention rheologists are a separate specialty entirely from GYN, and so their approach is different. They often will make incisions the size of a freckle, and they'll go through the wrist or through the groin under camera guidance, and then they'll shrink the fibroids one by one. And so it's also a tremendous option that can work for a majority of women. But of course, every woman, every person has different medical situations, different objectives, different considerations. So we would keep all those things in mind as we advise people.
Amazing, quite amazing how far everything has come. And with all of this that you're offering, and obviously you do a lot to keep up and within your practice and your field, what do you feel has been the key to your professional success?
Thank you, Dr. Farrakhan. I mean, I think about that sometimes. We talk about that with the group. I think what it comes down to, I mean, in many ways, what we see ourselves as doing is reinventing women's healthcare. We've often believed and we've experienced and seen that the system sometimes isn't so great for the average person, for the average patient, whether they be male or female. We happen to be in women's health. And so I think more than anything else, we really try to focus on the patient. We try to focus on delivering a better experience. And for us, there's many parts of the equation that connect to that. But it's not only what happens in the medical arena within the exam room, because from our perspective, when we talk about something as simple as fibroids, we try to approach it from a multi-specialty perspective. We see what we do as having different tools in a toolbox, and we let our patients ultimately decide. We like to listen, we like to educate, and then we ultimately like to empower our patients to make their own decisions that they think are best for them. And so I think that same philosophy applies throughout the entire organization, throughout the entire group in practice. Is we try to really make things as comfortable as we can for our patients. We try to listen to our patients. We try to ensure that the entire process that they experience with our group, whether it be with the front desk, whether it be with the physicians, whether it be with the medical assistants, whether it be with the nurses, all of that ties in together to create a superior experience. Because at the end of the day, there's just there's nothing more important than the service of the product. And I know that you know this better than most, right, Dr. Fialkoff? I mean, I know how much pride you take in your work and how much pride you take in taking care of your patients and doing a good job. And I think in this world that we're in today, unfortunately, sometimes people lose sight of the substance and think of a lot of the things that go around that. And if any one of us who's gone to a restaurant who's like maybe ended up in like a fancy place where like they serve something that looks really pretty and that has a lot of fluff around it and a lot of pomp and circus, but then you come and take your first bite and you don't actually, like what you're tasting. I think, anything, any product, any service, whether it be medicine or otherwise, that succumbs to that can be described in that way, I think is not going to really last or be successful beyond, maybe the first one or two tries that someone attempts something, because they're not going to be happy. They're not going to be satisfied.
Makes total sense. How did you choose the name that you chose, for your practice?
Yeah, it's kind of funny. I mean, it was we had actually hired a really fancy marketing firm, and we they gave us like a whole slew of different names. And at one point, I was having a conversation with someone I trusted, and we were, it was actually a family conversation between my co-founder, my wife, and I, and her sister. And, we were just having a conversation about different names, and we were just trying to figure out where the name was. And we read something, that we were looking at, just about, the way it was described. It basically was talking about how ultimately that there was this change or this evolution that's happened over the last few years, where a lot of organizations, there's a book called The Athena Project, or the Athena Doctrine. And it was talking about how there's all these different, environments that organizations often will take. And some organizations are more masculine, some are more feminine. And we were thinking about like the typical traits that are attributed to feminine organizations. They were organizations that listen to their people, that educate, that nurture, that invest in their team, that are long-term in their thinking, that aren't necessarily transactional. And so we were trying to figure out a way to translate that. And what we thought of was, well, Viva is like long live. Eve is, the quintessential name for women. We said, well, what better way to describe our commitment to women and this way of thinking, not necessarily just for our patients, but also for our organization and for our patients and for our staff. And so that's really where the name came from. Viva Eve is just long live women and long live the qualities that we attribute to these positive qualities and characteristics.
It's a great name because, I had no idea until, you sent me some of the photos of the images, and then I saw it and I go, it was really catchy because, it's like, you could say Dr. James Gohar or OBGYN of Forest Hills, but it was very interesting. And the colors also. It was very soothing. I love this picture too here of you. This is fantastic. I mean, the lighting, it's amazing. I can see that really you pay tremendous amount of attention to detail and quality, and I'm sure your patients are very happy. So we're coming to the end of the show, and I wanted to ask you, what would you like to leave as a concluding remark for those women out there and the viewers out there that you want to share?
Dr. Fialko, thank you again for having us. Look, I mean, I think just in conclusion, we invite all the women who are listening and watching today to come join us, come visit us at Viva Eve. We just recently opened up our new flagship headquarters. As many know, we've been in business now for over 40 years, actually, since the original iteration of our practice back in the early 80s. But this new location for us, it's a pretty beautiful space, as Dr. Fialko shared. But more importantly, we designed it around the patient. It's about 12,000 square feet. It's right on Madison Avenue. We are, we have, of course, the full suite of women's health services. We're not just, OBGYN. We are OBGYN. We are diagnostic radiologists, intervention radiologists. We are adding on a world-class head of plastic surgery to our group, Dr. Larry Reed, who we're super excited about, who will be beginning to provide services to our patients, in the late summer. And so, look, I mean, we welcome everyone to come and visit our practice and visit our group. We try to, do everything we can to, look at what we can do to make our patients more comfortable and ultimately provide a more comprehensive suite of services. So, again, Dr. Fialko, I really, really appreciate the time and appreciate you having me on tonight.
It was my pleasure. And, I'm happy that you got to share important information with our women viewers out there, and obviously also their husbands, so they can help their wives and their girlfriends, their, fiancés, or their mothers, their grandmothers. So, and thank you for taking good care of these women, because to me, women really are very important to our society. So thank you for participating.
Thank you, Dr. Fialko. It's been a pleasure.
Oh, pleasure. And for those of you watching, may you have a great week, and tune in next time for the next episode of A Time for Truth show. Good night.
Sometimes life can be so damn hard. You don't know where to go. Everything keeps falling apart. Yeah. You try to do your best, but only God knows that you've given everything you've got, but the world takes you down. You just keep moving on. Let your feet